My name's Corinne Palmer, and I'm the Director of Addiction Services for Behavioral Health. But in terms of how I'm a part of the Heart Failure University, I am the liaison consultant between the cardiology treatment team and behavioral health, so that if anybody does require any kind of behavioral health services, then I'm kind of like the contact person, and I sort of help out with that, that part of it. So today I'm going to talk about depression in heart failure. And one of the key things I also want to do as I start is to just make you smile and make me smile. So I have a picture of Luna there, because she always makes me smile. And you might see her later on in the presentation as well. So here's the things that we're going to talk about today. We're going to talk about how prevalent is depression and heart failure. We're going to talk about the risks of unrecognized depression in terms of heart failure, common symptoms to depression and to heart failure, because there is a lot of commonalities, which kind of makes us go, okay, which one is it, the chicken or the egg? And we're going to talk a little bit about how stress and anxiety fit in. And then one thing that I want to talk about as well is adjustment disorders, because sometimes it isn't depression that's going on with you guys or gals. It's more the fact that you just found out you've got a life-threatening disorder going on. And then we'll talk a little bit about what you can do and what we can do for you in terms of that. So the first thing I want to do is just give you some statistics about the prevalence of heart failure. And there are more than 5 million people that are currently living with heart failure in the United States of America. 550,000 cases a year. That's a pretty big number. And then in terms of depression and heart failure, 1 out of every 5 patients, 11 to 25% of people that are outpatient cardiac patients, and then when you're in the hospital, 35 to 70% are depressed. In men under 60 were found to be more depressed when they had heart failure. African American men are less depressed than white men. Women have a higher incidence of depression than men in general, but when it came to heart failure, then there was not a whole lot of difference between the two. And there's not a lot of difference between African American women and Caucasian women in terms of depression. Depression does increase with the severity of heart failure for a lot of cases. And then it also can cause 4 times higher risk of mortality if it's not treated. We'll talk a little bit about that. So in behavioral health, the way we diagnose depression is by using the diagnostic statistic manual, and we're in the 5th version at this point in time. So in terms of how we diagnose depression, there's got to be at least 5 symptoms that you have going on that include depression and lack of interest for more than 2 weeks at a time. Hi there.
Hi.
So the way that looks is like depression, a depressed mood most of the day, lack of interest in activities or pleasures, things that you used to enjoy doing. Sometimes a significant change in weight, like weight loss, weight gain. Having difficulty sleeping or sleeping all the time, sleeping too much. Then feeling kind of agitated or restless, or just kind of like apathetic, pathetic, not really active at all. Feelings of worthlessness or guilt. Difficulty focusing and concentrating, and then having recurrent thoughts of death or suicide. So the symptoms that are common to heart failure and depression, and by the way, if you have any questions, please stop me, and we can address those as we go along. So the symptoms that are common to both heart failure and depression, which you'll see, which is one of the reasons why I said it's kind of hard sometimes to figure out which it was, the chicken or the egg. So the symptoms are like heart failure results in decreased cardiac output. Decreased cardiac output results in just poor physical functioning. Poor physical functioning is associated with feeling depressed, and also if you don't have any energy and you aren't interested in doing something because you're so tired. Then we also look at if you have had a lot of weight loss or weight gain. And sometimes when you have heart failure, you all know that you accumulate water weight, and so as a result of the decreased circulation and the stomach's decreased ability to kind of deal with absorb all the nutrients. So sometimes that happens in depression too. Sometimes people overeat when they're depressed, and sometimes people undereat when they're depressed. And then with heart failure, a lot of times you have weight gain because of water retention. And we talked about the loss of appetite and the weight gain. Oops, sorry. So patients who have heart failure sometimes have difficulty sleeping because when you lay flat, you have trouble breathing. And so that's difficult for you to sleep. And then people with depression also don't always sleep well because they're depressed. And that's when I talked about how they sleep either too much or not enough. And then patients who have heart failure, oftentimes they don't have energy, and so they're tired, and so they sleep a lot as well. Talked about sleep. Talked about not having energy, and that's for both things. People that are depressed don't have any energy, don't really want to do anything. And then with your cardiac status, sometimes you don't have any energy and don't want to do anything. Obviously, if you have depression, you have feelings of worthlessness and guilt, difficulty concentrating, you have thoughts of dying or wanting not to live anymore. The same thing for people who have cardiac disease more advanced. Sometimes, they're just like, I'm tired of this. I'm tired of this poor quality of life. I don't want to live anymore. So it happens in both cases. So if you don't treat the depression, what are some things that can happen? So some of the things that can happen is that you can go back into the hospital again. Sometimes it can cause a reoccurrence of some kind of cardiac event. It can make the depression worse. It can make the heart failure worse. You can have more poor quality of life. It does increase the mortality rate. You have functional impairment, obviously emotional distress as well. Risks of unrecognized depression, poor health behaviors, which sometimes also, if you have cardiac disease and you're depressed, poor health behaviors. You just think, I'm just going to go ahead and just eat what I want. I'm just going to go ahead and keep smoking. I'm not going to stick to this diet. I'm not going to take this medicine. All of those things can happen. So I said earlier I wanted to talk about adjustment disorders, and so there are 3 types of adjustment disorders. One of them is related to just having a depressed mood. One of them is related to just having anxiety, and one of them is related to both having anxiety and depression as well. And the reason that I want to talk about these also is that sometimes people do get depressed initially when they get a diagnosis of having a disease like heart failure, but that doesn't last for a long time. It's kind of an adjustment period, and then you kind of move on and go on with what you need to do to take care of yourself and keep yourself as healthy as you can. Sometimes people get just really anxious, worry about what's going to happen. Am I going to die? To get nervous about everything, all these new medicines I have to take, what about all the side effects? So that period is like somewhere between 3 and no longer than 6 months. And that it doesn't mean that you're really clinically depressed. That's going to last for a long time. And sometimes that doesn't mean that you really need medication. It just means that maybe you need some education, or maybe you need to see a therapist to kind of work through some of the anxiety or some of the depression associated with it, but not require more intense treatment. So I said a little bit about it already. What contributes to getting a diagnosis of an adjustment disorder? Emotional behaviors or symptoms in response to an identifiable stressor. Significant impairment in your social, occupational, or other area of functioning. Stress-related disturbance doesn't mean that it's another mental disorder, but an exacerbation of a pre-existing mental disorder can also be the cause or not be the cause. And then once we identify the stressor and we take care of that stressor, then the adjustment disorder goes away. So obviously with one that is the depressed mood, we're looking at mood changes, feelings of being hopeless or tearful, sad. With anxiety, nervous, worry, feeling jittery, having separation anxiety, fear of losing some things, and then the combination of both. I loved this this picture, so I just thought I'd bring it. Anxiety girl, able to jump to the worst conclusion in a single bound. So let's talk a little bit about anxiety and heart failure. So anxiety and depression often occur simultaneously, as we've talked about in a lot of heart failure cases. Both of them can raise the mortality rate. And then we define anxiety as an emotional state that you're worried about the future. It's fear-based because you've perceived that there is some kind of threat, which if you get diagnosed with heart failure or cardiac disease, of course, it's a life-threatening event. And it's also perceived inability to predict, control, or obtain the desired result in a future situation. And you really can't predict or control necessarily what's going to happen with heart failure. So anxiety can cause people to hesitate to do things that they used to. They constantly relive the fact that this situation has happened and they're living through this threatening event. They avoid activities. They have recurring anxious thoughts that might impede their ability to sleep. Fear about the future and having a dreadful, drastic outlook of the future. So it can interfere, like we mentioned earlier, about people sticking to their exercise or taking their medication, following through with a healthy diet, or getting the proper amount of sleep. Connecting with your family and friends, you can just sort of separate yourself and not want to be socialized like you used to. And difficulty resuming job, career, or even involved in your family responsibilities. I like this one too. Stress is defined as a response to the demands of everyday life. It cannot even be all the time bad stress. People can have stress related to their daughter getting married or some big happy family function that's going to occur. It still can cause a lot of stress. But too much stress can be harmful to your health, and it can cause feelings of being overwhelmed or tension, anxiety. It can also make you feel a little bit short-fused and irritable. And so your mind and your body both play a role into how we respond to stress. Your body reacts by getting tense. Sometimes it can elevate your heart rate. It can elevate your blood pressure. It can elevate your breathing, kind of getting short of breath and feeling all anxious. And then ongoing stress, we know it can complicate heart failure as well, because it can weaken your immune system, your blood pressure can go up, your heart rate can get irregular, it can cause some damage to the arteries, it can actually raise cholesterol levels, and it can progress, the coronary problems can progress. So what do we do to manage anxiety and stress? Well, we try to understand the cause, which in heart failure patients, it's pretty obvious what the cause is, and learn to manage it. So develop coping skills on how to reduce the stress and how to deal with anxiety. If you do these kinds of things, of course, it's going to result in improving your heart health, and it's going to improve your mental health and your emotional health, and ultimately it'll improve the quality of your life as well. So I always think about, when I'm stressed, what kinds of things do I want to think about, or what kinds of things would help me feel better. And so picturing myself in that hammock somewhere in Jamaica is not a bad thing, and just breathing. For somebody else, being out on a sailboat, watching the sunset might just be the thing that can help them relax and feel less stressed. And then there's this picture I mean, how beautiful is that? All those pretty colors, trees in the water. That can help you just go and feel better as well. So, what can we do and what can you do? We can provide assessments so that if you are feeling anxious or if you are feeling depressed, make sure that you mention that to your doctor, and we can talk to you about that. We can provide you with some education, maybe some things you can do to help you relax, refer you to a therapist if needed. Relaxation techniques like meditation, yoga. Sometimes people think, well, you know, I've got this heart failure thing, I can't really do yoga, I can't stand on my head. But there are different types of yoga that they can teach you, and there's even chair yoga where you could be sitting in a chair and you can still do yoga. Stress reduction classes, and I know that Kaiser has a lot of them here as well that might be helpful for you. Eating a balanced diet as well. And oh look, Luna's back. So getting some exercise, and her favorite thing, playing basketball, getting more exercise. Make sure you have some fun. She likes to swim in the pool. Spend some time with your family and friends. Definitely get some rest. And that will result in a healthier, happy Luna, and it will result in a healthier and happy you.
Hello, how are y'all doing? I'm Andrea. I'm one of the physician assistants, and I work with the cardiology department. I'm mainly based out of Southwood, although you look familiar because I've seen you here a few times, but I don't recognize anyone that I've personally seen in clinic. I also work at the Town Park facility 2 days out of the month and also work at the hospital. So just to give you an idea of my background, I have a master's in medical science, but the reason I'm talking about exercise and heart failure is my bachelor's degree was in exercise physiology. So that's how I got roped into this. All right. So again, just like Lynn said, this isn't formal, so rather than waiting till the end, you're free to interrupt. That's not rude by any means. All right, so we're going to be speaking about exercise and heart failure. This is just kind of a general recap of, quote, heart failure or a weakened heart muscle where we tend to accumulate fluid. What can be done? As you all know at this point, we use certain medication classes that are proven by research to help with end outcomes. And the medication classes are the beta blockers. Those are your medicines like metoprolol, Toprol XL, Carvedilol, those probably sound familiar. Things like ACE inhibitors or ARBs, those are the lisinopril, Zestril. ARBs are things like losartan. And then the diuretic therapy, whether that's the Lasix or that different diuretic called spironolactone or aldactone. A lot of people like saying that one. I do too. So those are the three main classes of medicines we use to treat heart failure. Then you can also influence heart failure with dietary modifications. We probably nag you about the low salt. That's not added salt. That's all the sodium in your processed foods, anything's canned, bagged, processed in any way. We usually try to have heart failure individuals maintain a less than 2,000 milligrams or 2 grams of sodium in their diet. It's hard to believe in the American diet, we often consume over 4,000 milligrams or 4 grams easily. So it's quite a modification to make. For example, someone asked, well, how much is in a Whopper? And I had looked it up on the internet, and it was 950 milligrams, so almost 1 gram of sodium just in a Whopper. And you're supposed to stay less than 2 grams per day. And then you can also make lifestyle modifications. The slide used to say minimal alcohol, but I changed it to no alcohol because even if you're not drinking in excess, if you already have a weakened heart, consuming any sort of toxin is going to do nothing but hurt. So you really want to avoid it if at all possible. It's not to say you're going to, die if you have a glass of wine, but you really want to do your best to avoid it since the heart is probably already weakened.
So no wine also.
You want to refrain from it as much as possible. Just because, again, alcohol ultimately is a toxin, and if you already have that impaired squeezing function of the heart, I would just rather do nothing to compromise it. But again, you know, once for champagne or a glass of wine on a special occasion is reasonable. And then exercise. So we're obviously talking about the last bullet point here. So how do we classify exercise? So we have two different classes. First is the endurance activity, or what you hear, you know, cardiovascular exercise. And then there's resistance activity, things like people think of lifting weights, using resistance bands. So the endurance activities, you want to try to do 3 to 5 days per week. And then the resistance activity, your goal is 2 to 3 times a week. Okay? And then when it comes to endurance activity, you know, we're not asking you to run marathons or do triathlons. Low to moderate intensity. Some examples of those types of activities are walking, using a stationary bike, swimming, and water aerobics can be great for some individuals if they have a lot of arthritic problems, takes the weight off the joints, but you can still get the heart rate up. Things like yard work or gardening. So the point of endurance activity is to elevate the heart rate and then keep it up, you know, at a plateau level for a certain duration of time. Okay? And then the resistance activity, like we said, lifting weights, resistance exercise with bands or those tubes. And you can also do chair exercises. They have a chair class at Kaiser where, you know, you don't always have the agility that you once used to, so you can get some resistance benefit from even simplistic things like that.
What about hitting golf balls? Can you do that?
Yeah, that would be like a low-level activity, because if you think about it, you're probably not going to get your heart rate up and maintain it. And it's maybe a little bit of a resistance exercise. You're not, you know, a golf club isn't heavy per se, but I would say that's a low-intensity activity.
What about tennis?
Tennis, yeah. Yeah, absolutely. Definitely a lot of my patients couldn't play tennis, but heck yeah, if you can do some doubles and singles, that would definitely qualify as aerobic or endurance activity. Yeah. So why do we want exercise in people with heart failure? And then the next slide will say, well, who has proven that this is a benefit? So first, if you do regular exercise of that combination of resistance and endurance, it's going to increase your exercise capacity, and then this thing that we call VO2 max. So VO2 max is pretty much your maximal oxygen consumption. So the higher the better. Lance Armstrong probably has a VO2 max of like 85 or something. But if you do endurance training combined with resistance training, you can increase your aerobic capacity basically, and your capacity for activity. So the issue with VO2 max and heart failure is the way you get VO2 max is, stay with me here, stroke volume, which is the amount that gets squished out of your left ventricle, the blood in the chamber, with every squish. So with every pump, it's the volume that gets ejected into the body. So that's the stroke volume, multiplied by the heart rate, and that's your VO2 max. Now you can see the problem with that, because your stroke volume is going to be lower if your squisher doesn't work as good, and many of you have decreased squishers, so it's not going to eject the same volume that it once did, so your stroke volume is a little bit lower. Then we have you on all of these medicines that depress the heart rate, right? Like those beta blockers. So then the heart rate is suppressed. So therefore, your VO2 max is much lower. But with conditioning, such as regular exercise, opposed to being sedentary, you can actually increase that number despite the medications that you're on. Did that make sense? I know that's kind of abstract. Okay.
I have a question.
Shoot.
I hear a lot of times we talk about exercise, but I never hear you guys say anything about heart ejection fraction. Never hear that. If your heart ejection fraction is real low, you're very limited to what you can and cannot do.
Exactly. So, so the reason we don't mention the quantitative number as much, so when I'm talking about heart failure in this presentation, it's anyone with a depressed ejection fraction. And I mean anyone, 45% or less. Now, you can have two individuals with the same quantitative ejection fraction, but that they're completely different. So I have a guy who's a 10% ejection fraction, but he's so well compensated and young, and he doesn't have any other conditions. He doesn't have diabetes, he doesn't have blockages in the heart, that he functions well, where the next guy with a 10% ejection fraction is dependent on milrinone and is in the hospital a lot. So the number itself doesn't determine necessarily your clinical status. So you're exactly right in that everyone's different, and that's why I say we don't expect you to be jogging 45 minutes 5 days of the week, because there's a significant impairment. But what you'll see later in the presentation is really the data shows it doesn't matter, if you're like doing a P90X video, just do something and your quality of life will improve.
Right.
Okay, so that's why the number thing, there's so much variability, but these studies that I have on the next slide studied anyone between, 10% and 45%.
Okay.
Not as much, I don't know if anyone here has, quote, diastolic heart failure. That's really not a weakened pump, but it's a restricted pump. We don't have as much data on those types of folks, so this is only with folks that have a decreased ejection fraction.
Okay.
Okay, with weakening of some sort. Does that answer your question? Okay. So then besides increasing your exercise capacity, your ability to use oxygen, these exercises, especially resistance exercise, can increase your muscle mass, make you more stable on your feet, less probability of falls, which is obviously essential as we age. As you know, if you fall and sustain a significant fracture, your mortality decreases substantially. So you want to be as strong and as conditioned as possible based on your condition. Also increases your power. We spoke about balance. But I think what's the most important, you don't care if your VO2 max is 40 versus 44. You care how you feel on a day-to-day basis. But exercise, if done regularly, will increase your quality of life simply because you're able to do more. Whatever that may be, just getting your grocery shopping done, taking your dog for a little walk, and that's different for everyone. And then this says who. So I looked at 15 clinical studies between 1991 and 2000, which with regular exercise demonstrated definitive increases in VO2 max anywhere from 12 to 31%. And they didn't just use one type of exercise in the studies. They incorporated everything from walking outside, treadmill, cycle, the arm ergometer, which is like a cycle but with your hands, which can be great, again, if people have a lot of joint problems, back problems. You can't go on a treadmill or an elliptical. Things like environment that you're doing exercise in. Don't want to do it in the Georgia heat when it's 90% humidity and 92 degrees. A lot of you may be on fluid restrictions if you do have a very low ejection fraction, where you're only supposed to intake 1,500 milliliters per day. So, you really don't want to be in the high heat sweating buckets. You want to wear cool clothing, things like cotton or a wicking material, and then try to exercise indoors. Malls are big, you can walk, you can get your mileage inside. And then hydration, again, stay within your fluid restrictions, but you have to put in. So you're not consuming more if you go above your restriction if you're expending it out. So you don't want to drink, 64 ounces before you go to exercise, but enough that you're properly hydrated before you do aerobic activity. Some articles also condone a warm-up period. They're saying that because of the condition of heart failure, you require a longer warm-up period. Lots of the articles said 10 to 15 minutes. To me, that sounds like exercise opposed to a warm-up. So I'm just warm up, don't fly right into it. start your walking at a slow, comfortable pace, 1.5, 2 miles an hour, just to get the body accustomed, and then go from there. I think 5 to 10 minutes would be appropriate. And then make sure you do a cool down. Some of you all, depending on the stage of CHF that you're on, may have high blood pressure, but then later in the stages, if the heart gets really weak, you may have chronic low blood pressure. So just make sure you do a cool down. Don't just exercise for a half hour and then stop and sit, because you can get post-exercise hypotension, where you get some dilation of the blood vessels and your blood pressure tanks, and then you go, woo. So just kind of cool it down. Give yourself your body some time to recover.
You mean that isn't getting dizzy?
Yeah. Yeah, if that blood pressure goes low and you don't have good perfusion to the head, you get lightheaded, dizzy. And don't want to faint. That's bad. And then some exceptions. So times where you don't want to initiate a new exercise routine or continue your current exercise routine. If you have issues with chest pain, especially at low level activity, like walking on a flat surface, it's not the time. You probably need an investigation. Come see the doctor. If your heart failure is in a flare, or what we often call exacerbations, where you have increased swelling, your weight has gone up in the last few weeks substantially, if you're having trouble breathing at night, like Lynn mentioned, where you're having to all of a sudden prop yourself up on a lot of pillows to breathe comfortably, if your heart failure is in a flare, it's not time to push yourself to exercise. If diabetes is newly diagnosed and extremely uncontrolled, if your sugars are running 300, 400, 500, 600, that needs to be addressed first. If you're ill, if you have a cold, if you have the flu, if your immune system is already compromised and you have heart failure, just take it easy. Definitely with a recent event, whether that's a heart attack, a blood clot in the leg, a blood clot in the lungs, that needs to be adequately addressed and treated. Severe aortic stenosis. Does anyone have any problems with their heart valves that they know of? So the little doors that open and shut and control the flow. Okay, so this is separate from congestive heart failure, but it's when one of the heart valves is really, really tight, so it gets very stenotic. So it's hard for the left pumping chamber to pump blood through that itty bitty hole. So those people are not good candidates for exercise, period. So imagine how difficult it can be for that individual that has heart failure. You want to exercise so you can feel better, but that valve condition really doesn't allow you to. But that doesn't apply to any of you, so that's great. If your resting heart rate is very elevated, like over 120 beats per minute, you're already starting high and you're going to be pushing the system when you're exercising, and you're going to have an increase in that pulse rate. So you need to figure out why the heart rate is abnormally elevated. And then if your blood pressure is very uncontrolled, I'm talking like a systolic blood pressure above 160, you shouldn't exercise, because again, heart rate and blood pressure both have to go up to sustain exercise, because your muscles need increased blood flow and oxygen to sustain exercise. So it's normal for blood pressure to go up, but if you're already starting elevated, you don't want to get into stroke level type blood pressures. Make sense? Question? No? And that's it. Any questions? I know it's easier said than done. It's like weight loss, you can talk about it till you're blue in the face, but it has to be a lifestyle change, something you incorporate on a daily basis.